Don, so who are the best candidates for bioidentical hormone replacements?
Well, believe it or not, today's world, there's women even in their teens that are showing signs that their hormonal system is in trouble.
Okay.
Women in their 20s, some of them are getting hot flashes, believe it or not. As you get into your 30s and 40s, later 30s, and you start looking at today, in today's world, maybe you're entering that thing called premenopause. Even though that's early by the standards that we all know, because it's usually about 3 to 5 years before actual menopause. Not anymore. It's sometimes 15 years, beforehand. But not everybody's a candidate for bioidentical hormones, even though their hormones might be suffering.
Okay.
And so younger women, a lot of them are experiencing fatigue and weight gain. This seems to be the thing that's going on a lot with the younger, and they have a lot of symptoms around their periods, like premenstrual problems, and that's definitely a hormone problem. But I think what's happened is we're not focusing on why the hormone problem developed. You see, if you go to the doctor and you're a younger woman and you're experiencing those symptoms, and he does a blood test on you, then he can just look at your hormonal system and try to figure out what's going on. But it's not appropriate for a young woman to be getting bioidentical hormones or any hormone replacement.
Right.
But you know what a lot of them are on and taking in order to help their premenopause? Birth control pills. You know what birth control pills are? They're an extremely high dose hormone therapy. So to me, we've got to really think this whole birth control, using that as a therapy for younger women. So the younger women are not candidates for bioidentical hormones, in my opinion.
Okay.
The women who are in their 30s, in 30 to 40, they could be a candidate. However, remember that their hormones are fluctuating up and down. And so you could take a blood test and get a snapshot of where they are in that moment, but how do you know where they're going to be 2 weeks from now, or a month from now, or 3 months from now? Because they're fluctuating up and down. So a good practitioner, a good doctor, is going to be able to, first he has to understand what he's dealing with. He's dealing with a woman who is in premenopause, and she doesn't have low hormones. She's got hormones that are wildly fluctuating all over the place, right? So it takes a very skilled practitioner to know what to do, to be able to say, look, let's utilize these hormones in a specific way for a specific time frame to pull you out of this circumstance and situation, and then once we get you there, we're going to use the lifestyle adjustments and modification and get you healthy, and your hormonal system will come back, and you shouldn't need bioidentical hormone replacement. Right? That's the ideal for that person. Now, if you take the woman who is closer to menopause, once you're in menopause, you know that menopause means you have not had a menstrual cycle for 12 consecutive months. That's really the definition of menopause. If you listen to the doctors, they define it as, it's a disease, let's treat it. It's not that. It's just a time in a woman's life where they haven't had a menstrual cycle for 12 consecutive months. But what happens is, what is it though? It is the falling naturally of a woman's estrogen and progesterone, because remember, estrogen and progesterone are the things that are controlling your menstrual cycle, and what they're doing is guiding reproduction. Right? The reason you're having menstrual cycles is because estrogen and progesterone are working in tandem to create you being ready to have a baby. That's what it's all about. And then as soon as you didn't get pregnant that month, starts it all over again. The whole thing starts again, right? When estrogen and progesterone are falling, that means nature is saying, okay, it's time for reproduction to end, and it's time for you to go into a new phase, of life. When that happens, it's much more appropriate for a woman to start looking at estrogen and progesterone replacement therapy. But with one caveat. Why, though, would we want to be giving hormones to women who are menopausal when they're supposed to be falling to begin with? That's what's supposed to be happening. Why are we now giving them hormones? Doesn't make sense, does it? Even though that's the therapy, that's the treatment. Here's the reason why. If a woman reaches the point in time where the estrogen and progesterone are going to start falling, and her hormonal system is a mess when she gets there, it's going to be a disaster for her. And she's going to be flooded with symptoms, both mental, emotional, and physical symptoms, and we all know what they are: the hot flashes, the night sweats, the low sex drive, the fatigue, and she doesn't feel right in her own skin. She can't think correctly, or memory. All that is not what's supposed to happen. That's the result of a woman making it to menopause a disaster. Her hormonal system is a disaster. So when the estrogen and progesterone start to fall under those circumstances, now she has nothing to rely on. The hormones that was keeping her alive and propped up, they're now falling, and then it's like a house of cards, right? So I say that it really doesn't make a lot of difference. At some point, you got to decide to grab a hold of your life and start doing the things that are necessary to get you healthy. And the antidote for a lot of these hormone problems is just get healthier, learn how to do that. And that's what I've spent a lot of time thinking about, is how can we improve the whole hormonal system of women who are suffering like that without having to use bioidentical hormones. That's the key to it, and that's, I think, the thing that we've really got to had to start thinking about. And I put a lot of effort and energy into finding ways in which to do that. But it involves looking at your lifestyle and looking at how is it that you are going to remove the burdens that are causing the problem, and then give yourself things in order to promote better health. It's a two-sided thing. You got to stop. An alcoholic, you can't help them unless they stop drinking the alcohol, right? You can't help the person who's still drinking the poison. And that's what we've got to do, is show you what that poison is, make sure that you fix that, and then do things to rebuild. You can really help yourself if you do that.
Okay. Thank you.